You've seen them, the world-class hospitals, five-star resorts, and wellness destinations that seem to have it all. But behind the scenes, their success doesn't just come from service or marketing. It comes from something far less glamorous: cost leadership. Cost control is their hidden advantage, and it could be yours. The hidden power of cost leadership in hospital and tourism sectors. When you first stepped into the role as CFO, the financials were a mess. We were bleeding money across every project. It didn't matter if it was a highway, hospital, or high-rise. The costs just kept going up. When cost isn't managed strategically, both hospitals and tourism businesses suffer. Delays, budget overruns, poor experiences, and even closures. Cost management isn't accounting. It's strategic leadership. A luxury wellness resort in Bali expanded too fast. No cost controls. Result? $4.8 million in operating losses in just 1 year. Whether building a hospital wing or launching a resort, the real battle is won in the planning phase. Key elements: stakeholder alignment, clinical directors, hospitality experts, finance leads. Scope definition based on long-term operational costs. Infrastructure lifecycle planning. A hospital in Germany saved 17% in operational costs by planning energy systems before finalizing design. A Greek island resort used cost-focused guest flow planning to reduce staffing needs by 20% during low season. Estimates aren't guesses. They're financial blueprints. In both hospitals and tourism, inaccurate estimates can trigger a domino effect of delays and cost spirals. Tactics: data-driven parametric estimates. Historical benchmarks from previous builds. Dynamic pricing models, tourism plus hospital tech. A Caribbean wellness center used our estimation framework to forecast supply chain costs with 94% accuracy. That insight saved them from a $700,000 overrun. A budget is not a limit, it's a strategy. In healthcare and tourism, it must adapt to revenue models, seasonality, compliance, and growth stages. Strategic tips: separate budgets for medical versus non-clinical infrastructure. Integrate guest experience enhancements into long-term ROI. Use rolling forecasts during pandemic-like scenarios or demand surges. A chain of health spas created seasonal cost buffers to adjust staffing and marketing. Result? They operated at greater than 20% higher margins than competitors. Projects don't go over budget overnight, they drift there day by day. Without tight cost controls, you lose visibility, and then control. Key control tools: variance analysis, planned versus actual. Earned value analysis, EVA. Integrated reporting across functions. A UAE-based medical tourism hub used live dashboards to monitor costs across departments. They prevented a $2 million overspend by correcting a facility management contract mid-year. Cost leadership doesn't mean cutting corners. It means investing smart. What's the best return per dollar spent? That's the mindset that top hospitals and resorts use. Optimization frameworks. Lifecycle cost modeling, build plus, operate plus, maintain. ROI on patient/guest experience upgrades. Environmental and energy cost optimization. A maternity hospital cut energy costs by $1.1 million through predictive maintenance without impacting patient care. A boutique hotel chain switched to modular interiors, reducing renovation cost per room by 43% across 5 years. Let's zoom out. Life cycle recap. Strategic planning. Align outcomes and stakeholders. Estimating. Predict with precision. Budgeting. Balance ambition with control. Controlling. Adjust before it's too late. Optimizing. Lead through smart spend. This is how cost leaders operate, whether in tourism, surgery, or hospitality. If you want to lead projects that deliver impact and stay profitable, this is your edge. Enroll now in the Strategic Cost Management course for the hospital and tourism sector. In today's economy, those who manage cost well win, not just on paper, but in the real world. Click the link and let's build your cost leadership journey together.